Hello. Today we will talk about 5 types of vitamins that can lead to overdose and hospitalization. The first dangerous vitamin will be B12. Vitamin B12, or cobalamin, is an important water-soluble vitamin that plays a key role in the functioning of the nervous system, blood formation, and metabolism. It is essential for the production of red blood cells and the normal functioning of myelin, which protects nerve fibers. Vitamin B12 is usually obtained from animal products such as meat, fish, milk, eggs, and dairy products. However, for people living a vegetarian or vegan lifestyle, it is important to provide alternative sources of vitamin B12, such as fortified foods or supplemental medications. Taking large doses of vitamin B12 usually does not lead to an overdose, as it is water-soluble and excess is excreted through the urine. However, there are some rare cases of allergic reactions or intolerance to vitamin B12 preparations, so it is recommended to follow the doctor's recommendations on dosage. To avoid an overdose, it is important to follow the dosage recommendations for vitamin B12, which are usually indicated on the package of the products or recommended by your doctor. It is also important to consult a doctor before taking any additional vitamin complexes or supplements, especially if you have any chronic diseases or are taking other medications. The next dangerous vitamin will be B3. Vitamin B3, or niacin, is one of the essential B vitamins for health. It plays a key role in the metabolism of carbohydrates, fats, and proteins, as well as in maintaining healthy skin, nervous system, and digestive system. Avoiding overdosing on vitamin B3 can be important because large doses of niacin can have certain side effects, such as increased bleeding, lowered hemoglobin levels, liver problems, and others. However, an overdose of niacin usually occurs only when taking large doses that exceed the recommended daily allowance. To avoid an overdose of vitamin B3, it is recommended to follow the following tips. Watch your dosage. Stick to the recommended daily allowances of vitamin B3, which are typically 14 to 16 mg per day for men and 14 to 18 mg per day for women. Choose the right sources. Get your niacin from natural sources such as meat, fish, eggs, milk, nuts, and green vegetables. Limit the use of supplements. If you are taking niacin supplements, follow the dosage and do not exceed the recommended doses. Consult your doctor. If you have a medical condition or are taking other medications, consult your doctor before starting any vitamin supplements. The next dangerous vitamin will be E. Vitamin E is a fat-soluble vitamin that plays an important role in protecting cells from oxidative stress, supporting the immune system, and maintaining skin health. While vitamin E is important for health, overdosing can be harmful. Here are some tips on how to avoid overdosing on vitamin E. Watch your dosage. Stick to the recommended daily allowances of vitamin E, which are usually between 15 and 30 mg per day for adults. Choose the right sources. Get your vitamin E from natural sources such as wheat germ oil, sunflower seeds, almonds, spinach, apricots, avocados, and other fatty foods. Limit the use of supplements. If you are taking vitamin E supplements, follow the dosage and do not exceed the recommended doses. Consult your doctor. If you have a medical condition or are taking other medications, consult your doctor before starting any vitamin supplements. Avoid overuse. Remember that many foods, such as increased doses of vitamin supplements, can lead to vitamin E overdose. The next dangerous vitamin will be B9. Vitamin B9, also known as folic acid, is an important vitamin for health because it plays a key role in the growth and development of the body, the formation of red blood cells, and the prevention of fetal malformations in pregnant women. However, as with any vitamin, it is important to follow the correct dosage to avoid overdosing. Here are some tips. Stick to the recommended dosages. For adults, the usual recommended daily dose of folic acid is about 400 mcg. In pregnant women, this value may increase. It is important to follow these recommendations. Get folic acid from food. Food sources of folic acid include leafy vegetables, asparagus, spinach, broccoli, citrus fruits, seeds, nuts, grains, and trout roe. Be careful with supplements. If you choose a folic acid supplement, make sure that the dosage meets your needs and does not exceed the recommended values. Consult your doctor. If you have a medical condition or are taking other medications, discuss with your doctor about taking folic acid as well as the dosage. Avoid excessive use. Remember that an overdose of folic acid can be harmful to your health, so it is important to stick to the recommended doses. The next dangerous vitamin will be B1. Vitamin B1, also known as thiamine, is important for the normal functioning of the nervous system and energy metabolism in cells. Although overdosing on vitamin B1 is rare due to the fact that it is a water-soluble vitamin, there are some guidelines for its use. Stick to the recommended doses. Usually, the recommended daily dose of thiamine for adults is about 1 to 1.5 mg. For pregnant and lactating women, this value may increase. It is important to follow these recommendations. Get thiamine from food. Food sources of vitamin B1 include pork, buckwheat, chestnuts, sunflower seeds, egg yolk, and whole grains. Avoid excessive use of supplements. If you choose a vitamin B1 supplement, make sure that the dosage meets your needs and does not exceed the recommended values. Consult your doctor. If you have certain medical conditions or are taking other medications, discuss with your doctor about taking vitamin B1 as well as the dosage. Avoid self-medication. Do not take vitamin B1 without consulting your doctor, especially if you already have a diagnosis or treatment.